I'm Ellen Schmidt, nurse practitioner in the Department of Surgery at the University of Rochester. We see a lot of patients that don't have an interest in quitting smoking at their initial visit or consult, but once they understand the complications that can occur and can be avoided when you quit smoking before an operation, they are much more enthusiastic to at least try. And that's why we recommend they see a smoking cessation specialist with interventions weekly or every other week, as well as medications and nicotine replacement. They really are successful, especially 4 weeks before an operation. Research shows that the risk of heart attack, stroke, pneumonia, immune system, which is your body's defense mechanism, you can decrease those risks by about 30%. 8 weeks before an operation, studies show that you're actually improving your lung function as well, and you'll have less complications in pulmonary function too, so less risk of pneumonia. I see patients that want to quit smoking, usually referred by their surgeon or self-referred. Our surgeons recommend that you see someone because smoking cessation is much more effective when you have intervention with a health provider that specializes in smoking cessation. So you can be referred by your primary care physician, your surgeon, or you can actually just refer yourself.
So this program is different in that most people don't talk to healthcare providers around stopping smoking. You increase your odds of quitting by both using medications and counseling. We offer one-on-one individual counseling, which is not something that you really get much of when it comes to stopping smoking in the community. The one-on-one counseling sessions are really focused on education, planning, strategizing around stopping smoking, and prescribing medications. We also do phone consultations and telehealth via your smartphone or computer or tablet. So if you can't get into the office, you have a lot of options of staying in contact with us. Do you have any questions for me about this or how it works or why it would be better to meet a person? All patients are different. Everyone has different ideas about what works, what doesn't work, and my job is to try to figure out what's the best way for that person. So there's no real right way to do it. The right way to do it is whatever way works for you. Patients typically work with us on a weekly basis early on, usually weekly until they're quit for about a month, and then every 2 to 4 weeks out to 6 months after their last puff. But that's not a hard and fast rule. We work with people at whatever pace is meaningful to them. We have a lot of research that shows that the more time that you spend talking with a healthcare provider about stopping smoking, whether it be a counselor, a physician, a nurse, or someone else, the more time you spend, the more likely you are to quit. The best time to stop smoking is any time. I work with people from the age of 18 to 88. So if you feel like you're ready to stop smoking, or if you're not ready to stop smoking, or if you're thinking about it, we're happy to talk to you. So you can find out more about our programs at the Center for Community Health and Prevention by either talking to your doctor or giving us a call at 585-530-2050.